Hi, welcome back to Rebel Health. I'm Dr. Ellen Vora, a holistic psychiatrist based in New York City, currently coming to you from Sydney, Australia. And I just want to put out there today that I think there just needs to be more awareness and more of a public conversation about the fact that most psychiatric medications are addictive and have significant withdrawal. And this is a little bit overlapping with another post I did recently, but I just want to keep putting this out there because I find over and over again with my patients that people don't realize this. So both in the primary care setting or in your psychiatrist's office, when you're initially going on a medication, no one's having that informed consent conversation about the fact that you might feel really hooked on this medication. Like, you're starting this to help you, sure, but it might be incredibly difficult to get off. And I think that that's something that we should be talking about before you take the first pill. And then down the road, few months, few years later, when you are thinking about trying to get off your psychiatric medication, I want folks out there to recognize that there is such a significant withdrawal. And I want you to know that both to approach it with caution and with all of the gravity that it warrants, but also so that you don't go blaming yourself or saying that this is a relapse when you start to feel terrible in the process of getting off of a medication. I think the best thing that you can do is do a course like the Vital Mind Reset with Kelly Brogan, or get yourself in the hands of a really good functional or integrative psychiatrist who's familiar with the process of getting people off of medication, so you can do the nutritional and sleep and diet and lifestyle and supplement and meditation practices that support a taper. And then you go really slowly, as in working with a compounding pharmacy to go making infinitesimally small changes to the medication dose. And I find that that's actually what's necessary for people to get safely and successfully off of psychiatric medications. It's so striking to me that this isn't part of the conversation up front. And yet person after person has come into my office and said, I took myself off of name the psychiatric medication and now I'm feeling suicidal, or now I'm feeling severely depressed, or I'm crying every day, or I have brain zaps, or the nerves all over my body are aching, or my brain doesn't work, or I don't sleep anymore, or I have a panic attack every day. Things like this. I hear it over and over and over again. Often these withdrawal symptoms are worse than the issue ever was in the beginning, the one that got someone into a psychiatrist's office to go on a medication in the first place. So this is just something I want more awareness about this out there. So be cautious before you start a medication. Know what you're getting yourself into. And then if you're on medication and you want to get off, know what you're getting yourself into. Work with someone who can get you through that process slowly, safely, and with a lot of support. And just as a sidebar, this isn't to say if you're feeling depressed or anxious or you have insomnia or ADHD, do nothing. I think that there's so much that you can do. But this is sort of my favorite part of this whole process is you can do so much that usually goes unexplored, right? All of our doctors are basically just trained in putting you on a medication. And so there are unexplored avenues that can treat depression, anxiety, ADHD, insomnia. So that's the diet and lifestyle stuff. That's, to me, the most fun part of this process, and there's a lot. It starts with diet, starts with sleep, starts with exercise, starts with stress management. So look into all of these ways of managing your illness before you start the medication. Hope that's helpful, and we'll see you next time on Rebel Health.